Good evening, all. You are welcome to this session for the next lecture on epidemiology, where we'll be discussing communicable and non-communicable diseases. And during the course of the lecture, you will encounter some of the aspects we've discussed already. But today, basically, we'll talk mainly on the communicable diseases. When you talk on communicable disease, is mainly the infectious diseases that are transmitted from one person or animal to another, while non-communicable diseases are those that cannot be transmitted from one person to another, and they involve the chronic diseases like hypertension, diabetes mellitus, and other chronic diseases. Now, this is the outline we'll use for the discussion. We'll talk about some definitions as well as epidemiological triad, which we've talked about previously, but this is very important with regards communicable diseases. Principles of prevention. We also discuss that strategies of disease prevention and disease control. Now, by way of definition, what is a communicable disease? Simply put, diseases that are transmissible, that is communicable. The definition, any disease that is transmissible from a reservoir or source of infection to a susceptible host. It is also called an infectious disease. So you should take note of the keywords in the definition. 1, it is transmissible. 2, there is a reservoir or a source of infection, and the host is susceptible. So transmission from a reservoir or a source to a host. The host should be a susceptible host. That means he has factors that aids this transmission. So communicable disease is also called infectious diseases. Now, communicable disease is an illness due to a specific infection. That is, there's a biological agent. There should be an agent that causes this infection or a toxic product. Sometimes these agents produce toxins capable of being directly or indirectly transmitted from man to man, or from animal to man, or from animal to animal, or even from the environment to man. So it means the source could be an animate or an inanimate object. That is 1. And 2, you should know there is an agent or substances produced from this agent that will cause infection. Okay? So that is about the definition for communicable diseases or transmissible diseases. But why is this important? Why is the knowledge of communicable disease is important? Because it represents a huge burden of diseases, especially in our environment, in developing countries, because there are factors in our environment that aid transmission of these diseases, okay? And they account for more than 80% of death in low-income countries. You can see this is significantly important. If only 20% will result from non-communicable disease and 80% result from transmissible disease, it is very important. And approximately 5 million people die each year due to infectious diseases, okay? Now, you see, it affects almost nearly all developing countries. Okay, so you can see public health practitioners, epidemiologists have to spend a lot of time and resources in managing or controlling communicable diseases. Now, you should know there's changes in pattern of infectious disease in discovery of new infections and possibility that some chronic diseases have infective origin. Now, we said communicable diseases are transmissible. Non-communicable diseases are non-transmissible, and there are chronic diseases like hypertension, diabetes, cancers, and so on. However, you should know that some non-communicable diseases have been found to be infective in origin. Even the origin of those non-communicable diseases start from an etiological agent. For example, hepatitis B virus, okay, is the etiological agent, is an etiological agent for what? Liver cancer, okay? HIV is an agent for Kaposi sarcoma, human papilloma virus, for cervical cancer. You can see all these cancers are non-communicable, okay? These cancers are non-communicable or chronic diseases. And you can see their origin is from infectious agents. So there are some chronic diseases that the agent starts as infectious nature. You know, we talked about to a susceptible host. That host who is infected will have some certain factors that will make him susceptible, like what? Immunosuppression. Now, children are particularly vulnerable to infectious agent. Why? Because their immunity is low to fight infection. In some cases, you see elderly too are prone to such because of what their immunity is also low. Diarrheal disease, malaria are leading cause of death among children under 5 years. So the leading cause of death among children under 5 in our environment are pneumonia, bronchopneumonia, diarrheal disease, malaria. Cerebral malaria can cause permanent mental impairment. Okay? Infectious diseases are also destructive to health of adults, causing disability, a diminished quality of life, and decreased productivity in adults. Yes, you can see not only, even if they might not cause death per se, they could decrease productivity in adults. Now, there's a specific feature you need to know about this transmissible or infectious disease, that is co-infection. Now, because most of these patients are vulnerable, they are susceptible, they have low immunity. These transmissible diseases or communicable diseases could go along with some other infection due to low immune status of the patient. People infected with one infectious disease becomes more susceptible to another disease. For example, people with HIV/AIDS are more likely to become ill from tuberculosis or malaria. Okay? Now, because some communicable diseases share common risk factors, people are often infected with multiple diseases, okay, at the same time. Okay? Okay. Now, you see, the communicable diseases cause a lot of huge costs to what? At the individual level, okay? At family or society level, as well as even national level and international level. So you should know communicable disease cause a lot of burden in the society, not only at individual level, but also at both national and international level. Now, there are three important factors or conditions necessary for a communicable diseases. Now, there are three important factors necessary for a communicable diseases. Okay, number one, there must be living infectious agent. That is the pathogen, okay? The pathogen, the living infectious agent, number one, must be there. Number two, there must be a susceptible host, and there must be mode of transmission of agent to susceptible host. So there must be what? Mode of transmission to a susceptible host. Now, this brings us to a set of pathogen, hosts, and environment. Now, what is common of these three components or factor in this set is the word disease. Okay? It's the disease. So, this set is described as infectious disease model. Infectious disease model. So the infectious disease model comprises of three factors: the host, pathogen, and the environment. And the common factor between these three is the disease, okay? And this is described as the infectious disease model. Now, if you remember, we talked about the epidemiological triad, the epidemiology triad. Sorry, these slides look haphazard. If you remember, the triad contains these three factors we discussed yesterday: the host, the agent, and the environment. Okay? Now, the host must have demographic characteristic, biological characteristic, and socio-economic characteristics. Okay? Now, the agents could be biological agents, physical agents, chemical agents, nutritional agent, mechanical agent, social agent causing disease. And for the environment, of course, it is either physical, biological, or social environment. Okay? Now, let's talk about the agents. Now, the agents that cause disease can be a virus, bacteria, rickettsia, protozoa, fungi, helminths, etc. Now, the features of these agents, it must have a reservoir, a source, or a vector that carries it. Okay? It must be able to multiply, okay, for survival and sustenance of that infection. It must be able to what? Multiply. It must be able to emerge from its reservoir or host. It must be able to reach a new susceptible host. It must be able to reach a new susceptible host. It must be able to infect a new susceptible host. So these are the features that makes an agent infective. The infectivity of an agent is the ability to cause infection. So it must possess all these characteristics to be able to cause infection. Now, what are those factors? Factors that determines disease outcome. The factors that determines disease outcome, okay, whether infection takes place or not, may depend on a whole range of determinants, okay, which affects the host and the agent. And the three main determinants of the outcome are infectivity, virulence, and pathogenicity. The three major factors are infectivity, virulence, and pathogenicity. The infectivity of an agent is the ability to establish itself in a host. And the ability to establish itself in a host, okay, is the ability to cause infection. So infectivity of a host is the ability to cause infection. While the infectivity of an agent is the ability to cause infection. While the virulence, okay, of an agent is the ability to kill. One, ability to cause infection, infectivity. Two, ability to kill, that is very virulent. And pathogenicity and ability to cause a disease. Okay, so what is the difference between a disease and an infection? Somebody will answer that at the end, okay? So let's talk about the various routes or modes of transmission. Now, the modes of transmission could either be direct or indirect. The modes of transmission could either be direct or indirect. So when you say direct transmission, it could be from direct contacts with a pathogenic agent. Direct contact with a pathogenic agent is direct. It could be via droplets. Okay, somebody coughs, somebody sneezes, okay, and the droplet is inhaled by a susceptible host. That is droplet. Contact with soil, okay, inoculation into the skin, okay, then vertical or transplacental transmission. So what is the difference between vertical transmission and horizontal transmission? Somebody will answer that at the end of the lecture. I've asked the second question now. The first question is infection and disease. The second question, vertical and horizontal transmission. Now, the indirect transmission will require a vehicle. Is vehicle borne, and this vehicle could either be vector. Okay, a vector is an agent that transmits disease from or agents or infectious agent from one person to another. That is a vector. So the vehicle borne could either be vector borne, which could either be mechanical vector or biological vector. It could either be, the vehicle could be airborne, okay, airborne. It could be fomite-borne, okay. It could be on clean hands and fingers. So all these are direct. So when an agent is on a surface and you touch that surface, for example, okay, and you now contaminate your hands and fingers, you take the contaminated hands to your mouth or your nose, that is a form of indirect transmission, okay? Okay. So let's continue. Now, what are the various routes of transmission? Routes of transmission. What are the routes of transmission or the routes? When you say the routes, this is the manner in which the agent reaches the susceptible host. It may be via direct contact, via skin to skin, or mucosa to mucosa. Inhalation of airborne infection by coughing, okay? By coughing. That is, so it could be direct from skin to skin. It could be by inhalation, when you inhale, yes. It could be by what? Inoculation, maybe following dog bites, okay, that will cause rabies. So the route could be direct, it could be via inhalation, it could be via inoculation, it could be transplacental, which is vertical transmission like rubella, especially in the first trimester of pregnancy. So some infections can have more than one route of transmission. For example, the bubonic plague, okay, flea bites, okay, by pneumonic plague, which is transmitted person to person, okay. Sorry for the haphazard nature of the slide. I'll edit it and send a cleaner copy for you. Now, indirect transmission. Here, the agent must be capable of surviving outside the host. If you look at the direct transmission, okay, it has to reach susceptible host to survive. Now, for indirect transmission, the agent must be able to survive outside the host because it is not deposited directly into the host. It survives outside, then it's now getting contact to the host. Okay, you remember the 5 F's of indirect transmission. The 5 F's of indirect transmission. Flies, okay, fingers. You know, hand washing is one of the most important ways of disease prevention. Fomites, food and fluid. Okay, flies, they are vectors. Okay, yes, on all these flying vectors, like mosquito carries malaria. Okay, fingers, it's contaminated, Shigella, and so on. Fomites in soil, clothes, towels, handkerchief, okay, skin infection, eye infections, food like E. coli, then fluid like as in cholera. So the next thing you need to know is susceptible hosts. Why is the host susceptible? Okay. What makes a host susceptible? Now, what makes a host susceptible? The natural body defense. This may be non-specific, like skin, cilia, hair in the nostril, etc. These are non-specific. Or specific defense, like genetics. In the genetics, like you have the Buffy antigen. Then you have artificial defense. So you should know immunity are of two types. There is the natural immunity and there is the artificial immunity. Now, the natural immunity are something that is just innate in an individual. He is born with it. Artificial is acquired via immunization. So a host, when this immunity are being destroyed or diminished by some certain factor, it makes a host susceptible. So a susceptible host has diminished natural and artificial immunity. And what are the factors that will cause, that affect the host immunity? Factors that affect host immunity. Age, extremes of age, how they call this reduced immunity. Sex, so you tell me how sex affects immunity. Pregnancy, reduced immunity. Nutrition, reduce immunity. Trauma and fatigue, reduce immunity. Okay. Now, let us look at some important terms. Sorry for these haphazard slides. The first one is infection. Infection is the entry and development or multiplication of an infectious agent in the body of man or animals. An infection does not always cause illness, okay? Because infection may be subclinical or inapparent, okay, like polio, or they may be manifestation or clinical infection. So what you should know, don't mind me with this my infected slide. Infection, you should know, is one, there is entry and development or multiplication. Okay? You see? One, there must be entry. Two, there must be multiplication. Okay? Of what? An infectious agent. This is the pathogen now. Okay? Into the body of man or animal, which is the host. Okay? But you should know it does not always cause illness. So because there could be subclinical manifestation and there could be clinical manifestation. So when you are asked to define infection, is the entry and multiplication of infectious agent into a susceptible host with or without manifestation of symptoms clinically. Okay? Because they may be subclinical manifestation. Now, there's the term you should be able to differentiate contamination. You should be able to differentiate contamination from infection. Now, contamination is the presence of an infectious agent on a body surface, on or in clothes, beddings, okay, toys, surgical instruments, or dressings, or other articles or substance, including water and food. So, now, if contamination, you should know, is presence of infectious agents on surface. This is the key word here. On the surface. While in infection, there is entry. Okay? In infection, there is what? Entry, if you remember, and multiplication of that in the host. So contamination remains on the surface, while in infection, there is entry and multiplication. In fact, in microbiology, you define infection as tissue invasion of pathogenic organism, okay? That amounts up to the power of what? 10 to the power of 6. With manifestation of clinical symptoms. So you see, in contamination, there is no any manifestation of clinical symptoms. Now we've seen the difference between infection and contamination. Now, what is a vector? Vector commonly is an insect, is that also, or any living carrier that transports an infectious agent from an infected individual or its waste to a susceptible individual or its food or immediate surrounding. Okay, so you should know a vector is an agent that transmits infectious agents from an infected individual to a susceptible host. What is a reservoir? A reservoir is any person, animal, attribute, plant, soil, or substance in which an infectious agent lives and multiplies, and on which it depends on primarily for survival, okay, and where it reproduces itself in such a manner that it can be transmitted to a susceptible host. Now, for a reservoir, they depend on that reservoir to survive. They live there, they feed there, they survive there, okay? And from which they can be picked up and transmitted. It is the natural habitat in which the organism metabolizes and replicates. For example, in man, HIV is the reservoir. HIV, man is the reservoir for HIV. Okay? Now, what are the source of infection? Source of infection. Okay? That person, animal, object, or substance from which an infectious agent passes or is disseminated to the host is the source. Okay? It may or may not be the same as a reservoir. For example, a contaminated needle, water, food, and milk. So you should know, in case you are asked, what is the difference between a reservoir and source? Source is just the agent from which, it's just the tool for disseminating that agent, and it picks the infection. The source usually picks the agent from the reservoir and transmit it to the host. Now, hookworm. The reservoir is man. The source is the contaminated soil. Tetanus. The reservoir is the soil. The source is the soil. You can see it can be the same, it can be different. Typhoid. Reservoir man. Source infected water. Food or milk. HIV. Reservoir is man. What is the source? Okay. Now, since we've seen reservoir, the agent usually lives in the reservoir, depends on the reservoir for its survival and transmission. What are the types of reservoir now? Types of reservoir. Now, reservoirs could either be human reservoir, it could be animal reservoir, and it could be non-living reservoir. So these are the types of reservoir. Okay, it could be animal reservoir like human reservoir like typhoid, animal reservoir, rabies, yellow fever, avian flu, and so on. Non-human like the soil and what do you call it? In tetanus, for example. Then let's see examples of human reservoir. Reservoirs. Now, in human reservoirs, You could have cases according to the spectrum. These cases, there are clinical cases, clinical, and you have in latent phase of a disease. Now, these cases, you could have primary cases, index cases, secondary cases, okay? Then you could also have carriers. Now, human reservoirs, you have cases. That means they are people that have infection, that is infected cases, okay? They are carrying the infection. They could be primary, index, secondary. They could range from spectrum. You see people with the disease manifesting. Some may not have the disease. Then you could have others that are termed as carriers. So these human reservoirs, you could have cases and carriers. Now, these carriers could be incubatory, convalescent, or healthy carriers. Now, the duration of these carriers, you could have temporal, based on their duration, they could be temporary carriers just for a while and the disease disappears, or it could be a chronic carrier, you just continue shedding. And based on the portal of exit of this disease, it could be via urinary carriers, intestinal carriers, respiratory carriers. So human reservoirs are classified into cases and carriers. The cases are those who carries the infection and you see them infected, manifesting the disease, or they may be in a subclinical phase where you don't see active infection. Then you could have reservoirs that are carriers. They do not show any sign of infection for that disease, but they harbor the organisms and they are just spreading. Okay? So those are how carriers. So a case defined as a person in a population or study group identified as having a particular disease, okay, health disorder, or the condition under investigation. So it is the case of a human reservoir. It has a particular disease, so you describe him as the case. Why these are carriers now? An infection or infected person or animals that harbors a specific infectious agent in the absence of discernible or visible clinical disease and serve as potential source of infection to others. Three elements have occurred to form a carrier state: the presence in the body of disease agents, the absence of recognizable symptoms and signs of a disease, okay, the shedding of the disease agent, okay, in the discharge or excretions. Okay, you could see it occurs either due to inadequate treatment or immune response. The disease agent is not completely eliminated, leading to a carrier state. So when a patient is a carrier, it's because he is not properly treated, and those organisms continue to survive in his body, or his immunity cannot completely clear. It cannot completely clear the infection. They continue surviving, and at the same time, that individual is not manifesting with the symptoms of that disease. A case It's an infected and clinically ill. A carrier is infected but not clinically ill. So a carrier may be healthy carrier like in typhoid. Incubatory carrier is carrying at the incubatory period of that organism like measles, okay, and HIV. It could be at the convalescent states. They are called a convalescent carrier. Now, you should know, why is this carrier important? Why are carrier important? Why? Now, they can outnumber the sick patients. They are often not aware of the infection, okay? They are often not aware of the infection, not likely to take preventive measures. You remember the story of Typhoid Mary? My third question, somebody will tell us the story of Typhoid Mary. Okay? Chronic carrier can serve as a source of infection for a long time. Okay? Yes. Now, sometimes when you see a healthy individual and a carrier, you can't even differentiate them. Sometimes you even feel as if the carrier is the healthy person. Now, in your exams, you come across animal reservoirs. Now, in your exam, you might be asked, mention 5 zoonotic diseases transmitted by animal. So, animal carrier, mostly zoonosis, okay, can occur when a man uses animal for food, okay. Teniasis, the worms, tapeworms will now be transmitted if the meat is not well cooked. Vector transmitting from animal to man, like yellow fever. Animal bites humans, like rabies, okay. Animal contaminates human environment, bubonic plague, okay. So please, an assignment for you. List 10 zoonotic. Okay. So that is number 1. A. B. For the zoonotic disease, you mention the vector and the agent of zoonotic disease. Please take this serious, and you should write it down in your jotter, okay? Because it's a common exam question. Zoonotic diseases. You mention the disease, you mention the vector, and you mention the agent, okay? Now, of course, reservoir in non-living. We say they are non-living. So it could be soil and inanimate, okay? Matter can also act as reservoir for infection. Example, soil may harbor agents that causes tetanus, anthrax, okay, and coccidiomycosis. you should know that. Now, in summary, we said reservoir are three: human, and in human, there are cases and there are carriers. Two will be animals, causing what? Zoonotic disease. I gave you assignment. Please make sure you do the assignment. Dr. Mariam will ask you. Three, inanimate or non-living reservoir. Which could be the soil. So that is that about communicable diseases. Then let's briefly talk about some of the things we already reviewed just for revision. We talked about epidemic. Is the unusual occurrence in a community of disease, specific health-related behavior, or other health-related events. Clearly in excess, you can see the keywords there, in excess of an expected outcome. Epidemics can occur upon endemic state too. Okay. So if we also talked about endemic. It refers to the constant presence of disease or infectious agent within a given geographical area or population group. It is the usual or expected frequency of disease within the population. For example, we say malaria is endemic in our environment. So please don't joke with all these things. We also talked about hyper-endemic and holo-endemic. If you remember, we said hyper-endemic expresses that the disease is constantly present at high incidence or prevalence rates and affect all age groups. While in holo-endemic, the excess expresses a high level of infection beginning in early in life and affecting most of the children population, while in the adulthood it now equilibrates. If you remember, we talked about pandemic and exotic diseases. We said pandemic and epidemic usually affecting a large proportion of population occurring over a wide geographical area, such as a section of a nation or entire nation, a continent or the world. So it's cross-continent. When epidemic is intercontinental, it is called pandemic. Exotic disease is when you are carrying diseases to areas where they do not otherwise occur, like malaria in the UK. We also talked about sporadic, say disease that occur randomly. Okay, what sporadic means scattered about. The cases occur irregularly, haphazardly from time to time, and generally infrequent. So these are situations where diseases occur randomly in the society. However, a sporadic disease could be the starting point for an epidemic to spread. So we all talked about these. We said eradication and elimination. We said eradication, okay, is termination of all transmission of infection by extermination of the infectious agent through surveillance and containment. The word there is what? Complete extermination of infectious agent. Eradication is an absolute process, all or none phenomenon. and restricted to termination of infection from the whole world. You completely exterminate an infection, that is eradication, while elimination is used to describe eradication of disease from a large um, geographical region. Diseases which are amenable to elimination in the meantime are polio. So we talked about all these. So the ultimate goal of public health is to prevent, control of disease, the preservation of good health, and promotion of good quality of life. So what do you mean by prevention of a disease? So when you say prevention of a disease, okay, there are actions aimed at eradication, elimination, and minimizing the impact of disease disability, okay? Or if none of these are feasible, retarding the process of the disease and disability. So prevention is aimed at eradicating, eliminating, or minimizing the impact. Now, the concept of prevention is best defined in the context of levels, traditionally called primary, secondary, and tertiary prevention. So we talked about this yesterday, the levels of prevention. We said there is the primordial, primary, secondary, and tertiary prevention. So I don't think we need to go into all these, but finally, I think we'll talk, because we've already talked about level of prevention yesterday. So maybe we'll just briefly talk about control, disease control. Okay, when you say control, what does it mean? The term disease control describes ongoing operation aimed at reducing, one, the incidence of disease, two, duration of disease, and consequently the risk of transmission. Okay, the effect of infection, including both physical and psychosocial complication, the financial burden to the community. Okay, control of communicable disease. A good knowledge of organism is necessary, okay, to know the most vulnerable stage and direct control measures to control a communicable disease. Okay, if you want to control a communicable disease, one, you must identify the weak points. Two, you may institute more than one control measure, e.g. malaria. You use insecticide-treated nets, okay, IPT, vector control, early treatment, and so on. Now, control may also occur in three levels: control of the reservoir, control the route of transmission, control the susceptible host. Okay, so how do you do that? The levels of control is control or you eliminate the reservoir of that organism. Two, you interrupt the pathway of transmission. And three, you protect the susceptible hosts. Okay, now how do you control the reservoir? Okay, it depends on the reservoir. If an animal, you eliminate, you kill the rodents, you vaccinate dogs. If it is human, you do early diagnosis, disease notification, isolation, treatment, and quarantine. Okay, Now you can disinfect, you do epidemiological investigation of epidemics. We talked about this earlier. Now for early diagnosis, you do rapid identification of cases and carrier for treatment. Then diagnostic investigation to trace source for descriptive epidemiology. Okay. Now for disease notification, okay, you have bodies, both local and international bodies. We talked about isolation yesterday and various aspects of the difference between isolation and, okay, let's just revise it. Isolation is separation for the period of what? Communicability of, okay, the infected person or animals to prevent spread of infection. Now, what you need to know about isolation, the person you are separating is what? Infected person or animal. While in quarantine, you are limiting the freedom of movement of a well person, okay, that is exposed to a communicable disease, not longer than the incubation period of that organism. Why? For isolation, for the period of what? Communicability of that infection. So it's in your previous lecture. Okay. So how do you interrupt transmission? Now, the interruption of transmission, you break the chain. It may involve alteration of the environment, e.g., water treatment to break in cholera outbreak, alteration of vector breeding site, hand hygiene, respiratory etiquettes. Now, the next is protection of the host. Protect the host. Active immunization is by giving toxoids that stimulates the host to produce their own immunity. Passive immunization, you give preformed antibodies. And you should know that active immunization lasts longer because the body this will stimulate the body to produce its own immunization. While passive immunization has an immediate effect, but it's short-lived. Chemoprophylaxis is to give patient drugs when they are exposed to such environment. Okay, so now non-specific measures, active immunization, sanitation, education, okay, and okay. So I think we are going to stop here. But before we stop, let me summarize control. We said there are three major levels of control of disease. One, elimination, control or elimination of reservoir. 2, interruption of transmission, and 3, you protect the susceptible hosts. Okay, so you should know that these are the 3 measures you use for control of organism. 1, elimination of reservoir, which depends on the nature of the reservoir. If it is animal, like rodents, you kill, you eliminate them. If it's like animal like dogs, you give vaccination. If it is human, you do early diagnosis and notify, give disease notification, you isolate individual, you treat individual, and you quarantine the exposed individual. That is when it is human. Okay? When it is non-human, of course, you disinfect the environment. Then this is control of reservoir, whether animal, you know what to do, whether human or inanimate, or the environment. Okay? Now, the next stage of control is interruption of transmission. That is, you are breaking the chain of transmission. If it is cholera, for example, you treat water, you chlorinate water. Okay? Hand hygiene, regular hand washing, use of face mask, okay, for okay, because when you use face masks, you interrupt all transmission by droplet. So that is what do you call it? For thirdly, you protect the host. And protecting the host, we said it could be via active immunization, passive immunization, as well as chemoprophylaxis. So you should know these 3 levels of control of transmission. Now, so I think we'll rather stop here, and I'm going to send you the slides. Sorry, we have some distortion in the presentation of the slides because the font was changed immediately to have this background logo, and unfortunately it now distorted the entire slides, but the one I'll send you will not have such distortion. So I'm going to stop here, and I'll be expecting you guys to ask questions. And aside that, there are some questions I asked, which I expect you guys to answer the question. So now I'm going to unmute you, and you answer those questions I asked before you ask your own questions. So if you want to answer the question now, you can unmute yourself and answer those my questions. That is if you are following. Hope you are all following. Are we together? I've been talking alone. Yes, are we together?
Yes, sir.
Yes, I asked some questions. So who wants to answer them?
Okay, let me try.
Okay, go ahead.
You said the first one is difference between infection and disease.
Yes.
Okay. Infection is an attack and growth of microorganisms inside the body, therefore causing harm to the body. While disease is due to the weakening of the body's immune system after the infection of any kind of pathogens, then starts corresponding automatically showing symptoms of pain, fever, etc. And also,
You are not very clear.
uh,
We can't
okay,
hear
maybe
you
the network.
clearly.
Okay, can you hear me now?
We can hear you. The disease is not very clear. Your explanation for the disease is not very clear. Come again, but the infection is clear.
Okay. I said disease is due to the weakening of the body's immune system after the infection of any kind of pathogens. The body starts responding automatically, showing symptoms of pain, fever, etc.
Yes, excellent.
And also, disease can be contagious or non-contagious, while infections are contagious.
Excellent. You can see disease are manifestations of infection. When we say infection is invasion, multiplication of pathogenic organism in a susceptible host. So when the infectious agent gain access to this susceptible host, okay, it breaks down the immunity and manifests, okay, with signs and symptoms of tissue invasion of pathogens. So when the immunity breakdowns from the manifestation of infection, that is disease. Yes, that is good. Who can answer the second question?
Okay, let me first one.
Are you the only one in the class? Where are the others now? Where are the ladies? Let me look for somebody and ask now. And the class is not complete. What is happening? Okay, I can see a lot of you are not here. Yes, any lady you want to try? Only Dr. Aminu is talking. Yes? Where is Hafsa? I can see there are two Hafsats here. So one of the Hafsats should answer. Hafsat Idris. You see, Hafsat Idris is not even in the class. She just logged in and ran away. Hafsat Idris. So take notes. Hafsat is not here. Halima.
Yes, sir.
What is my second question? You see, she's not following. Aminu, tell us the second question.
Okay, if I have you correctly, so I said the difference between horizontal transmission and vertical transmission, or
Halima, can you differentiate the two? Horizontal transmission and vertical transmission.
Okay, sir, let me try.
Okay.
I think horizontal transmission, vertical transmission is transmission from mother to infant via the placenta. While horizontal transmission, I think
Can it be transmitted to infants via placenta?
fetus.
Okay, mother to child, bro.
Mother to child.
So, okay, continue. Yes, that is correct. Why horizontal?
While horizontal is the transmission through blood or blood products.
Okay. Is she right? Aminu?
Yes, sir.
Is she correct?
I think for the vertical transmission, she's right. For the horizontal transmission, I think it's not correct.
So what is the correct answer?
Okay, what I believe horizontal transmission, the transmission of like viruses transmitted among individuals of the same or different species. For example, pneumonic plague are transmitted horizontally when a person sneezes and another inhaled aerosolized bacterial particles.
You see, horizontal transmission, not necessarily, she's actually right. You see, vertical is from mother to child. Horizontal is maybe from person to person, either via blood product, either via is intercourse and so on, or even direct, as you said. Yes, what's the third question? You guys are not writing down. Okay, any question? Any question? So we don't have any question. So I think we've had our lectures for week 2 on public health. The slides, the remaining slides of this particular lecture will be shared. Subsequently, when we are doing public health, we'll take the lecture on non-communicable disease, because these communicable diseases are more important and they feature more often in your exams than non-communicable diseases. So thank you very much, everyone. Tomorrow, we are going to commence the third week